Okay, today I'm going to just share a tips on how to answer pathology question in OSCE for phase 1 medical doctor programs. So without further ado, let's go. So pathology questions is usually have 4 to 5 components with clinical history and also physical examination are usually given at the beginning of the questions. So you will be given a clinical history and also physical examination findings. These two points or findings are usually given at the beginning of the question as in the form of a scenario to the questions, and afterwards there will be two pictures usually given. Number one is the gross picture, and the second one is the photomicrograph for you to identify the histopathological features. So there will be usually 4 to 5 components, which is number one is the to this for the components usually need you to describe the gross features and also to describe the histopathological features, and next is to give a diagnosis for the patients or the cases, and sometimes they will ask the risk factor for the disease, the diagnosis that you've given, and maybe sometimes they will also ask other investigation that are relevant to this patients. So for the first two, so this one and also this one, um, components is usually uh, need you to interpret the features or the photos and also the photomicrograph givens. So you need to interpret those photos, and then for the diagnosis, the risk factor, and these three part is usually to test your knowledge. When you are describing the gross features, you need um, to list the findings based on the photo given. So based on the photo given, you describe the findings that you can see, the features of the gross features that you can see in the photos. You should describe. Now, one is the site of the lesions, for example, in proximal or distal upper pole, or for example, in renal cell carcinoma, you can describe the lesion is at the upper pole or at the middle part of the kidney or at the lower pole of the kidney. So you need to mention, or you just mention in a words, in the sentences regarding the site of the lesions. And maybe you can the second point, you can uh, describe the color of the lesions. So sometimes the colors play a role in the in making the diagnosis, gross diagnosis. And the next one is the margin of lesions. So you need to see the relationship between the lesions and also the surrounding tissue. Either these lesions has invasive margins or not. So if it is invasive, usually it is more of a carcinoma. If it is a pushing margin, means the tumor just push the normal tissue away from the center of the lesions. So this could be benign lesions. So this will give you a clue regarding the diagnosis. And apart from that, maybe there will be some additional info. For example, hemorrhages, which usually you see it as red or blackish color in the gross photos, or sometimes there will be necrosis. Necrosis usually will appear to be in a grayish, pinkish in color. What you don't have to do is to list down whatever you memorize, because if you list down whatever you memorize, sometimes that points or that features is not found in the photo given to you, so that will not give you any marks, and you are at waste if you put down the features that are not relevant to the photo given. The next one is to don't give more than required features. So if the questions or the component of the question asks you for, let's say, 3 features, 3 gross features, then you should answer 3 most striking features that you can see in the photos. Do not give more than more than they are required. So if you give, for example, the components need you to answer 3, they ask for to list 3 features. If you list 4, the last one usually won't be counted even though it is correct or true answer. So like in this case, for example, so you can see this is a uterus in blue, dark blue color here. I highlighted with the uterus, and also the ovary. So you can say that the ovary is grossly enlarged. So it is a grossly enlarged. If you can measure it, you can say the measurement here. And if there's orientation, you can say the right or the left ovary is enlarged. And you can describe the external surface of this ovary, which is the external surface of this ovary is smooth and shiny. This is proven by, you can see this shiny here, the shine here. This is the reflections of the flash. So it is a shiny external surface. So you can put that in your description. So next, describing the histopathological findings. It almost the same with the to describe gross findings. What you need to do is to list the findings based on the photomicrograph given. Whatever you find in the photomicrograph, you should describe it. So how you describe it? Usually, in a pathology kind of a description, you need to describe the architecture of the lesion of the tumor or the lesion, the tumor cells first. So maybe you can say this tumor is forming glands, or this tumor is a solid kind of tumor arranged in solid sheets or a nest or a clusters of cells. And next, okay, remember the first one is architecture. The next one is the cells. You need to describe the cells. What you need to describe is regarding the nuclear pleomorphism. So you need, if there is a variability in size and shape of the nucleus, so you can say there is a nuclear pleomorphism. Or sometimes you can describe the cytoplasms. For example, in a renal cell carcinoma where it has a clear or just a whitish cytoplasm, so you can say the cytoplasm is abundant and whitish in color. And when it is a clear cells, you can say that it has a nice border, cell border is distinct, so you can see nicely the cell border. So that's what you describe regarding the cells. And the last one, you should add in the additional findings. So apart from seeing the architecture of the cells or the lesions, and apart from seeing or describing the cell itself, you can also describe the surrounding tissue. For example, in the cases of squamous cell carcinoma, where you can see there is a desmoplastic stroma there. Or maybe you can mention regarding the mitosis that are present, or necrosis if there is any. Or sometimes you can see apoptotic body. You can also mention that in your description. But the most important thing that you don't have to do is to list down whatever you memorize. This is again similar with describing the gross findings. So sometimes whatever you memorize does not seen in the photomicrograph given, so that is another loss. So you won't get points for that, even though it is true if it is a correct answer for the particular diagnosis or the particular lesions or particular diseases. But if it is not seen in the photomicrograph, then do not list that as your answer, because it won't carry marks there. Next is to give do not give more than required features. This is also the same with the gross findings or the gross feature, describing the gross features. If you give more than what is required, usually they will take the first one. means if the question asks you for, let's say, 3 components, 3 features, then you list 4, the fourth one won't be counted even though it is true. So it is said if the first or the first 3 answer is wrong and the fourth one is correct, but the fourth one is not counted, then you will lose mark that way. So the most important thing is to give just what are required in your answer. So let's say this example, this is a renal cell carcinoma, a clear cell variant or clear cell type of renal cell carcinoma. So you can see this is the thin fibrous septae. So I highlighted with a yellowish color here. So all of these are the thin fibrous septae. So you can see that these tumors are arranged in a solid nest or solid cluster. So you can see there is not much variability of the size of the tumor, the nucleus, sorry. There's not much variability of the size and shape of the nucleus. This is one nucleus, this is another, this is another. So you can see that the nucleus is somewhat almost the same size and the same shape. So there's not much polymorphism here, but what you can see is the cytoplasm is abundant. So this one cell, sorry, again, this is one cell. So you can see the nucleus is at the center here. The nucleus is at the center here, and the cytoplasm is abundant, and it has clear color or the whitish color of the cytoplasm. So all of this points toward the clear cell renal cell carcinoma. So this is how it looks like, and what you should describe is separated by thin fibrous septae. You can say that the nucleus is not pleomorphic. It has abundant cytoplasm, abundant clear cytoplasms, and if you see any inflammation or additional info, for example mitosis, you can add in your descriptions. For the diagnosis, this is what the question usually tests your knowledge regarding the diagnosis or the condition of the patients. So based on the clinical history given, the physical examination findings given, and the gross features that you give or you interpret, and also the histopathological features that you interpret from the photos and also photomicrograph given, then all of these should help you to arise to the diagnosis. So what you can do at this point onwards is to give the most possible diagnosis based on these 4 things. So you should think the most possible diagnosis first to give in this patient. Again, do not give a lot of diagnosis, do not give differential diagnosis, just give one solid possible diagnosis for this patient based on the all of these things. So this is how we test the examiner test for your knowledge on the how do you tie everything up. How do you tie the clinical history, physical examination, gross and also histopathological features to arise to the diagnosis. So this is what we test, how we test your knowledge is. Next is the risk factor. This part is also involved in to 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 test your knowledge regarding the risk factor of the disease. For example, in a patient of in the cases of squamous cell carcinoma of the lungs, so the risk factor is the cigarette smoking or living in a polluted air, highly polluted air area. So that is the risk factor to develop squamous cell carcinoma of the lungs. So, but bear in mind, the risk factor is also what you need to give is the most relevant risk factor to your diagnosis. So do not give just a random or generalized factors. So that won't be count as well. So just give the most relevant risk factors to diagnosis. And again, I stress it here. If the question asks you to give a specific number of risk factors, just give specific numbers of risk factor as needed. So do not give extra risk factors or answers, because extra answers usually don't count even though it is true. They will count somewhat. Sometimes they will just count the first answer. For example, if they ask 2 risk factor, then if you answer let's say 4, then they will just mark the first 2 answer, and the third and the fourth answer they won't be looking into it even though the answer will be true. So you need to be specified, and you need to be confident enough to give 2 most relevant risk factors, or the most related risk factors towards your diagnosis. And the last component is usually the other investigation. So the question will usually ask, what are other investigation that you would like to do to confirm your diagnosis? So this in this particular part, you need to include other laboratory, radiology, or any type of investigation that are related, I stress here, related to your diagnosis. So you need to be to give the most relevant or the most related investigation to your diagnosis, to help you to give rise to a diagnosis. For example, if let's say your diagnosis is pulmonary tuberculosis, so what are other investigation that you need to do? So usually we need to do maybe sputum for acid fast bacilli staining, sputum for Zinisen to look for acid fast bacilli staining, or you can do Mentu test, or you can do chest x-ray, or sputum CNS, TB CNS, to look for the organism that could help you to give rise to your diagnosis. So there are what are the other investigation that usually means. So the most related the investigation to your diagnosis, to help you to rise to the diagnosis. And what you need to do is to be specific. This is the most important thing. Be specific regarding your investigation, what type of investigation that you need to do. So for example, if you think that this patient need a full blood count test, you just stated that full blood count. You do not write blood test. So because there are tons of blood tests available to be done. So so you need to be specific, and that test should be again related to your diagnosis. So if you need to do full blood counts, you just stated full blood counts. Do not say blood test. So blood test because of that how you say, because the test is too general, so you won't get marked just by simply write a blood test. You need to be more specific what kind of test that you need to do. Same as if you need to do sputum test, please do not write sputum test, because sputum test won't give you any marks. For example, in tuberculosis patient, you just specify sputum for acid fast bacilli. So that is more relevant or more related to your diagnosis in comparison to just stated sputum test. So the sputum test is too general, and it won't give you any marks even though you write it. And I think by that, thank you. I end my sharing session for now. So if you have any more questions, you can ask me through my Instagram, Facebook, Twitter, WhatsApp, Telegram, or anything that you know that I'm on. So you can ask me there. So I will try my best to answer your questions and try to help you. So good luck in your exam, and I wish you all the best. Thank you.